Welcome to the Not in the Job Description podcast. I'm Scott McLaughlin.
And I'm Chris Kiernan.
No matter what type of job you've had, there were situations that happened to you during work that you couldn't wait to tell your friends about.
We interview a variety of guests about some of their crazy stories from work, from entry-level food service industry jobs to doctors and attorneys. We will explore funny, gross, embarrassing, scary, and sometimes almost unbelievable stories that people have experienced while on the job.
Keep in mind that our guests or the companies they work for may be masked in order to protect the innocent, or maybe even the guilty. On today's episode, we talk to Dan, who is in the medical device sales industry. Welcome, Dan.
Thanks.
Hey, Dan.
Appreciate it.
So medical device sales, I mean, when I think about that, I think this could be one of 1,000 different things because there's so much technology involved. Tell us about what kind of medical device sales you're involved in.
Currently in spine hardware fixation sales. Work for a large distributor. So 1099 independent contractors.
Okay.
I have responsibilities of managing about 60% of the state of Ohio and work with orthopedic and neurospine surgeons for, a multitude of things: degenerative spine, trauma, tumor, deformity. So very, very challenging and intriguing environment in the medical device sales arena.
Yeah, and with the way my back's been feeling, I'm going to have to keep you in very close contact.
Oh, yeah.
So before we even get deep into that, how does one, what's the background? What's the schooling? How do you even get into this business?
My background, let's take it back to college. I have a degree in kinesiology. So, study the body in motion, and you can you go in multiple directions with a degree in this. Some of my, friends went off into med school, chiropractor school. They went to sports medicine, athletic training. And then, there's some of us that get into sales. And so you kind of luck into it, right? Cast a large net and have a network. And, I'm from Western Pennsylvania and moved to Ohio to actually work in logistics with FedEx Freight.
Okay.
That was my first job out of college. Knew nothing about logistics, but hey, trying to find anybody willing to learn this industry. So while I moved out here, hey, I'm going to network with the right people and try to either get into pharma sales or med device sales, and I didn't have the background in sales. I played sports through college, played baseball, and not enough time to have side jobs. Especially in retail sales or whatever. And oddly enough, met my wife, when I first moved out here, and her roommate when she was in college, her boyfriend, now husband at the time, was waiting to get into med school at Wright State.
Okay.
Came up here from Oklahoma and was working as a scrub tech in some of the hospitals there in the Dayton area. And, we kind of hit it off, had similar backgrounds. And he's like, hey, you know what? I think I'm going to get into this medical device sales. And I'm like, I really wanted to get into this. And I kind of piggybacked off his.
You wanted to leave FedEx for that?
Yeah. Yeah. Well, hey, it was a great place. Coming out of college and getting a management experience like right away is a slippery slope. Being 22 years old and
you get to learn from your mistakes immediately.
A lot of mistakes being made. But he decided to go with one company that he was interviewing with, and then said, hey, to this other company he decided not to work for. Said, hey, why don't you call this guy? Similar backgrounds to me. And so I jumped in and started doing, hips, knees, this total joint reconstruction world with a small company out of Florida, and kind of just evolved and morphed from there and got into spine. And that's where I've been in spine now for almost 14 years now. So,
and I can assure you, this is the first time in this studio that "get into spine" has ever been said before.
Get in. Yeah, right.
So you how many different types of apparatuses or apparati? I don't know. I went to public school. How many have you sold? I mean, you have to have a certain amount of knowledge in order to sell these things.
Yeah.
Because you've got to talk to doctors who know the body front and back of that particular place you're operating in. How many different devices have you worked on selling?
Oh, wow. I mean, I don't have a number off my head, but in the spine world, it's funny. We talk about, you have a patient and pathology, and you have a room with 5 orthopedic spine surgeons and 5 neurosurgeons, and they'll look at the same image, and you'll probably get 7 answers on how they would treat it. And so whatever that is, we have everything from minimally invasive, maximally invasive, to treat that patient. But I was very fortunate when I started in the spine industry. I worked for it was Synthes. Has sold and merged, and I think was arguably probably, and I'm biased towards it, probably one of the best. At from an education standpoint, and kind of how the company worked, and it really invested a lot of time. I mean, I went through a lot of training, clinical training, and kind of how to have those conversations and not sound like a moron when you're talking to a surgeon, and they sniff it out pretty quick. If you have the slightest clue about what you're talking about. So it was a year process of going in and spend 2 weeks and do some training, and then get grilled by surgeons, and then go back for another week and get a little bit deeper into it, so you can have these conversations when a surgeon says, hey, we've got a patient, and I'm trying to achieve X.
Right.
What do you have? What do you have to help me? Because I'm using this other company, and I'm having some struggles here.
Yeah.
And what do you have? And so be able to craft that conversation as to why I have something that's going to make their life a little bit easier.
I got to think initially that was probably the hardest part of the job, just the intimidation of going in and knowing that you're going to talk to this surgeon that's a spine surgeon, right? How smart are these guys?
Yeah.
And you're trying to tell them why, your device is better than the other. And they're probably thinking, what the hell does this guy know? He played baseball for Penn State, right?
Yeah, absolutely. Yeah. I mean, first of all, Penn State too. So being here in Ohio, but no, you're right. I mean, it is, I think there's something with us, sales guys, there's something wrong, I mean,
I know there's something wrong with you. I can tell.
Yeah, right. So, but you're absolutely right. There's certain surgeons that you have that conversation. They're open, receptive. They want to, they kind of like the industry and want to learn a little bit more about what you have and what you offer. And some of them are like, hey, once again, you don't have the right letters after your name, and you're never going to have that. So I'll call you when I need you. And so you learn very quickly. You kind of, you get your butt handed to you. You learn from it. You move on, and kind of, you start to learn about people and their personalities, and, okay, how do you profile them? And who can I talk to? How can I, there's some surgeons that are okay. They're receptive to being challenged a little bit, and have those clinical conversations. Some of them, it's once again, you'll never have that conversation with them ever again, and that's fine. I mean, with all due respect, they have way more training than I did, and so I provide a service and try to be this value add, right?
Yeah.
And I really enjoy working with the surgeons that see you as a part of the clinical team.
Right?
Yeah.
And then on the flip side, is there a situation where you're going in and you're talking to the surgeon, and in your mind you're thinking, how the hell is this guy a surgeon? I could do this better than him. I mean, certainly you don't have that, cockiness, I know, but I'm sure, like anything else, you have great ones and you have not so great ones.
Mm-hmm.
And when you come across the not so great one, are you mentally thinking like, oh boy, I don't ever want to go to this guy?
You do. Once again, in our world, you're like, boy, I'm trying to start up a business and trying to get things going. You can't be picky,
right.
So, but there is it's like, hey, slippery slope as to, man, like what's the blowback on this? If we do this and things go south, and then the patient ends up somewhere else, and now it's your product that's in them, and so once again, I don't have the letters after my name to make that decision, but in the back of your mind, you're like, okay, all right, this one's going to be a challenge.
Yeah, when I was doing a little research on what exactly are medical devices, it says that a medical device is any instrument, appliance, implement, machine, apparatus, there we go again, implant, vitro reagent, software, or material that the manufacturer intends to use alone or in combination for a medical purpose. Of all those things, what do you deal with a lot of software, or is it mostly implants? Is it injectables? Like what do you deal with?
So implants, so you're talking about titanium material or a type of plastic we call PEEK. It's polyether ether ketone, right? It's visible. You can see through it on an X-ray, but it has its purpose to, hold a space open, while bones are healing. But now we are in the new age. There's software. We have navigation in the operating room where it's like a GPS, for your body, and you can see instruments live, right? So it's trying to make this, us better and more accurate, more specific, and improve the outcomes. And now you've got this world of, AI that we're delving into, which is going to be really, really unique, and, custom implants now versus kind of, I have this massive set here of different sizes. And I think I was talking to Chris coming over here, and what you offer, I think we maybe can pare it down and be really more patient specific, which I think ultimately will be better for patient care.
Yeah, you get some just-in-time inventory going for individual specifics.
Yep.
That to me is like the end-all, be-all. But there's still a bunch of I don't know, they don't call it body farm, but essentially all the pieces for knees and things like that they take off cadavers and things. They've got those in different sizes that they literally just keep stored.
Yep. We have, when you're dealing with what, we call allograft tissue is, the donor tissue. And we use that still in spinal surgery for fusion purposes. But then, you have your sports medicine with tendons and ligaments and for reconstruction. Yeah, you're right. It's just, it seems like an odd thing, but now, you're trying to get into more synthetics that maybe they'll last longer, right? They don't have such an expiration date, or you can transfer from hospital to hospital easier because of human tissue and the tracking, and it's very rigorous and adds to it. So
okay. Now I know when I was probably about 7 years old, my father had both of his hips replaced, and this was like when I was 7. That was like 1910. So I remember my dad did not want to stay in the hospital, so he came home the day after. And back in the day, that thing was like a 2 weeks in the hospital. Now I have a father-in-law who had hip surgery, and he was dancing the next day. Like your ass is up and moving.
Yeah.
Back then it wasn't like that. And I remember them showing the hip socket replacement that they put in, and it was this steel shiny thing with the ball on it.
Yep.
And coincidentally, my wife later on in her art career ended up drawing a pile of those in a pencil art, which is kind of bizarre. But that got me thinking, like, how much of the stuff that you've sold in the past, because of how quick technology progresses, how much of it's obsolete?
Yeah, you're right. Especially from like saying hips, right? It's still the same concept, right? Improve the approach. Now that's why they're up, and now they learn a little bit more. Hey, let's get up and get moving, but we can be more minimally invasive, less tissue disruption. So we're always moving it in the direction of, how quickly can we get the patient back, right? And what do we have to offer? And so, from a spine perspective, it's kind of interesting, the evolution into minimally invasive spine, because of software and navigation allows the surgeon to not have to open up and see everything. They can be more specific, and you're trusting software, and it's pretty accurate. And then, with motion preservation, like, what you do with a hip or a knee, right? You're kind of replacing that. We're doing that in the spine for the right candidates and patients, and not, we're learning what happens, when you put screws and rods and fuse them, right? If the right patient comes in, the right candidate, we can preserve that and kind of circumvent what the cascade that happens, right? So it's kind of interesting to see, from 2000, the type of constructs, that the surgeons, what they had, right? Well, the best at that time to now, 2023, it's night and day. It's different.
I'm sure.
You look like an erector set, that you're like, wow. How did we put this in?
Well, you've also got me wondering, like, how much of the advances are product specific, or, hey, maybe we shouldn't make a 17-inch cut down the side of this person's leg to replace their hip. Like, how much of it is this is really technology versus, hey, we found out not to destroy all this tissue, because that's really tough to get up and going.
Yeah, no. So it's kind of a the approach to that. Yeah, you're right. Is to okay, hey, let's not disrupt the tissue, right? Because it typically doesn't heal back to the way it was before you cut the tissue. A lot of scar, there's scarring that's there, but we do have to change the implant, right? The instruments are set up for this maximally invasive exposure. Now we've got to try to find an implant that's smaller and can hook around, a corner, especially from a hip, what they can do, with an anterior approach on a hip is amazing. I'm like, how do you get there? How do you see it? But they're trained on it, and the instruments are so precise and specific to help them achieve that. So it's both, right? You got to change the implant with the approach, but it's kind of cool to see the evolution and kind of how it's now not this massive 2-3 week thing. For some of these patients.
And do you see some of the old equipment that you sold back in the day? Do you look at it and just go, "Wow, I can't believe that was the best we had"?
Right. Yes. Yeah. Right now, I mean, we have patients that come back because they have to have time. It's time for the adjacent segment has now degenerated. Right now, we've got it, and you're like, "Wow. What? Yeah. What is this?" But at the time, it's like this was cutting edge, and it's like, oh, wow, we've pared it down, make it smaller, make it a little bit easier to use, and it's like, man.
Like, wow, a paper mache vertebrae. I didn't realize we did that.
It's crazy, yeah. So and it's fun to see the evolution, and I'm kind of looking forward to. I think this pandemic kind of put a little pause on kind of how we do things, and so now it'll be interesting, and the world of mergers and acquisitions are upon us, especially in spine. So
one of the things I find fascinating, because we've talked before about this, is not only do you sell or try to sell them some of this equipment and educate them on new advances, but part of your job is to actually be in on the operating, right? And maybe, and some of it is that's when you're trying to show them the benefits, right? Is right there during the procedure. So you've probably seen some kind of pretty cool surgeries and things, right?
Yeah, absolutely. I mean, from pediatric surgery to, you're talking about spine oncology to minimally invasive degenerate spine and scoliosis. So, it really is. It's unique. And once again, every customer is a little bit different, and what your role and responsibility is. And there's some that say, hey, you're part of my team, and let's look at the MRIs, let's look at the CTs together, let's talk, let's strategize, let's plan. That's where it kind of keeps me going, is that side. And then there's some that says, hey, stand in a corner,
hand me a screw,
and when you're called upon, you speak.
But
outside of that, you don't exist.
Right.
And so it's learning that. But yeah, I mean, I've seen a lot, and it's rewarding for those to see some of these crazy things that kind of come through the operating room, and it's like, hey, how's that? I always ask, hey, how's that patient doing? And it's great. It's like, hey, actually they're doing really well, and if you have the opportunity to make a suggestion as to hey, did you think about let's maybe try something different. What do you think, doc? Well, tell me more. And I think that's really cool to be a kind of a part of that, and have someone that says, I trust you, and I'll listen. Ultimately, they make the decision, not me. They make the decision, but it's cool to be able to talk clinically and make some suggestions, and it's cool to see them work out.
Well, and a good surgeon is going to want to use every tool in the toolbox, right? And that's what you are to them. And the good ones. Because they know you've seen some things, and maybe you could relate back to, oh, hey, I saw this other surgery, and this had a similar situation, and here's how they work through it. So.
And now being so deep into this and seeing so many different types of procedures, and it's now having an opportunity to manage and educate others, younger, and like, hey, we got this surgery, and it's pretty vague, when they schedule it, but they're like, hey, I know you're involved in this, so just get me what I need, right? And so it's like, hey, let's think about this, because you get in and there's so many, they pivot, change of plans. We're going in this. Do you have this? Do you have that? And it's like, yep. I thought about that. I thought about maybe some of the challenges that we would face. I got it. And it's a rough feeling when you're like, no, didn't think about that last night when I was at 2:00 in the morning when I was stressing about this, big surgery. So,
yeah, you mentioned bringing in, like, if you're training people and how nice that is. I gotta imagine this field of technology moves so swiftly. I always think about people going into things like computer science. Do you think they teach them at the bit and the byte level of computer science, or are they like, okay, this machine will help you write in 6 different codes? I wonder, do you guys take them through the evolution of, yes, we used to use this, but now we use this, and here's why?
Yeah, I mean, that is a part of the process as to, and knowing, right, each surgeon and how they approach things, right? And it's like, hey, these guys are more old school, or they want to be a part of the new cutting edge. So you've got to know it. You kind of have to have that depth and knowledge of how it was done before and how it's moving, and kind of know, because you're going to get a phone call.
Yeah.
And you're going to have an opportunity. And so you need to understand what the surgeon's trying to accomplish and how their approach is. And so you do. And it takes a long time, and you have to see a lot and experience it. And you also have your butt handed to you, because you show up and you're like, God, that was not the way I wanted it. Did not go well. We got through it, but it did not go the way I thought in my mind. So, yeah.
For some of those old school surgeons, do you just keep like a jar of leeches in the back of the car?
Yeah, right.
You got to have something to sell to everybody, right?
Yeah, absolutely. No, but there's you got to have some of them. You ask, like, hey, do you have? Remember we used to use these type of implants? Do you got? We discontinued those a decade ago.
You don't have a clearance rack for them?
Yeah. No, and then there's some where you kind of get nervous, and you say, hey, we're rationalizing this because there's only 3 surgeons in the country that use it, and we can't put it on our shelf. We and so you're like, hey, doc, I know you rely on these, but can we move, into this, this era?
2023.
Let's think of it. Well, no, I like it. And I appreciate those type of surgeons. Like, I use what I use and it works for me. And so those are great customers to have. And then you kind of panic. You're like, oh my God.
Well, you'll definitely get some repeat away from him. You'll get some repeat business off of those wooden knees they were still selling for you.
Yeah.
Right. They'll be back.
Yeah,
That's
they'll be
good
back.
for them. Good business.
Yeah. Right.
So, I was going to ask how often you find yourself in the operating room, but I guess what's a day in the life of a medical device salesperson?
Boy, it is a puzzle that you put together every day. So depends. If you're new and you have a new geography and you're prospecting, you're spending a lot of time cold calling, right, and trying to get in front of surgeons. Now, hey, post-pandemic, we're changing the way we do things right now. We're trying to figure out how do we reach the customer differently. Before, you knock on doors, or you're in the hospital, you see somebody, you sidebar them, have a conversation. So for us, it just, my life now, because we're so busy in the operating room, it's you're planning for the plethora of surgeries that, we're very fortunate to have some great customers and supporting them and getting through. So you're trying to get all your instruments and implants in and sterilized and passed off to sterile processing. And hopefully you have everything you need, implants, instruments for that next day. Show up and the cases surgeries start going, right? And you're kind of getting through that day and adapting, and the phone's ringing because somebody else needs something across town, or another surgeon who's on call needs something, and now we've got to pivot and try to scramble to get a body over there to cover surgery. But we're also still thinking about a sales plan. How do we still grow our business? We're hunter mentality. And so I think that's a big challenge, is trying to take care of your current customers and still grow customers.
Right.
So, every day is a different puzzle. I don't know if you've ever seen the show Mayor of Kingstown. It's like there's a character in that where you kind of feel like every day, as soon as your eyes are open, that phone starts ringing, and it's like, oh God, what is gonna happen today?
Even in my job, we always joke that as soon as your ass hits the chair, it's like someone shot a starter pistol and you are off to the races.
Yep. Yeah, and the people in our industry that have been around do it well. There's a lot of us that like chaos.
Mm-hmm.
It just, and some of us say, God, I wish there was less of it,
Yeah.
or boy, it's time to try something new. But as soon as you get a week of you go on vacation, all of a sudden you're itching to get back into in the trenches, and you're like, I need chaos in my life to function.
Now, do you guys have a lot of administrative support? Because surgeries aren't done on the fly. I mean, they've got a surgical schedule. So do you know, like, okay, April 10th, I have to be at this hospital, at this OR with this doctor?
Yeah, so that's a baseline, right? And it's never it constantly changes every day. You could show up and say I have 2, and you walk out, oh my God, we just did 7 because now surgeons are because they pushed patients off because of pandemics, right?
Mm-hmm.
When you're talking about neurological issues, they progress quickly, and it's like, hey, I just saw this patient in clinic and I had to admit them to the ER, and now our days change.
Yeah.
So we do have, there's app services that it depends on what health system you're working in. A lot of the elective surgeries get scheduled and then they send it to us in an app. And so we kind of have an idea there, but it's maybe correct 50% of the time.
Gosh.
So that's
part of your chaos right there, brother.
Yeah, exactly. You show up and you look at a surgery board and say, oh my God, like when did this happen? We decided to schedule this last night at 10 o'clock. Like, anybody want to call me?
Yeah.
Heads
up.
So yeah. So you start sweating and panicking. So it gives you a baseline, but you have to still have contact inside that, your customer's, his office, right? Surgery scheduler. Hey, what does this look like? Has anything changed? Please keep me abreast if anything, changes on your end while you're here on business hours, because I've got to make moves, and it's not easy,
And so then do you have like a team then? Because you can't be in more than one place, right? At the same time. So 3 surgeries, you just have a team. So it's not like exclusive your territory. You have a team of people.
We have a team,
cover that
team of
territory.
people, and they're given certain hospitals accounts or surgeons, and we, as kind of how our model's set up. Once again, we're contracted to sell, specifically a company, and we have some other things that we do too, to provide more services to the surgeons. But anyhow, we run lean on people, and it's by design. Versus someone that's a W-2, all direct employees, maybe have more boots on the street. But like I said, we like to run lean with people. But we have a team, and you kind of everyone's doing something every day, and trying to piece that thing together.
And so then in this team, when a new hire comes on, what's the one job that you guys like, we'll save that for the new guy?
Oh, yeah, you're right. The new guy, you always cut your teeth learning, there's a whole nother world that happens in the basement, right? In sterile processing and working. And it's very vital. It's very crucial. And to, learn to have good relationships with these people, because they will save you when you need something done really quick. They'll prioritize you. But that's the tough thing is piecing everything together, the melee of what happened the day before. You're looking at this mound of instruments, and like, man, I got to put this all back together again and re-rack it and put implants back in here and go again. And then they have to go over to another hospital and do the same thing. And it never works out, because we're finding, supply chain is
Sure.
a challenge, and,
Right.
What are we missing? why,
Yeah, right.
why is I have a set that's half the stuff is missing and we don't know why. So yeah, that's the big challenge. You know, we always send the new person is the taking care of the basement and running the FedEx and is
Right.
you know
The grunt
one
work.
that, yeah
Making
and
sure
then
the leeches are fed.
yeah, feed the leeches, right? And so and then you kind of progress and you're like, hey, we'll let you come up and see the daylight and we'll put you in the operating room and
Maybe
and
give you a meal every now and then.
yep
Yeah, very
yeah, little
nice.
peanut butter and jelly sandwich, that's
Nice.
fine. You know, but yeah, so there's a process to it and so and it doesn't sometimes now it's challenging to find that person that wants to kind of go through that that process. So there is a lot of turnover there. Like now,
Interesting.
I think I'm worth more, or I need to
Right.
be doing something different. And it's no, this is
Yeah.
the way
This
it's
is how
gonna
you cut
go.
your teeth,
This is how you
right?
cut your teeth, and there's and you earn it, right? So
Right.
So, of course, patient outcome is the most important thing long term for your business, right?
mhm.
If you have this great product, but 8 months after somebody has it, they have to have it removed. That doesn't matter how great the product was. It turns out it wasn't great. Um, I wonder, like, how much of your business do you have to be focused? Because really, you're in the sales business, right? You have
Uh-huh.
great products, but you're in the sales business. How often do you have to focus on your competitors because they're making something similar or they're trying to kick up their technology for a better product?
Right. You are always looking over your your shoulder, right? No matter what you have, because that's in spine. There's so many competitors. I don't think I think that's probably one segment of the medical device that has so much competition.
Interesting.
And because people spin off out of the larger companies to start a smaller company, or the surgeons say, hey, like I'm gonna start a company,
Yeah.
right? And
Gotcha.
they might have
Vertical
little,
integration, right?
right? And so which is for us, it's great because we're independent and we can kind of look around to say, hey, I don't offer that with my current the current contract, and so we kind of have some latitude to go. And I think we're more value add to our customers. Say, hey, we don't have that in our bag, but I can reach out to that company and
Yeah.
we can get a contract with them and provide that for you.
Gotcha.
But you rewind and as a W-2 employee, right? And
Yeah.
you don't have that latitude.
Right.
You've got to go, hey, I gotta sell. There's a box here, and I've got to sell what's in the box. And so sometimes, yeah, you would lose business.
Right. I was going to say, you run
yeah.
the risk of pissing off your current customers by getting new customers then.
Well, you're right, because they can be very territorial. They like, hey, I like you. I'm using your product. Yeah, it's good, but I like you and kind of what you offer and provide, to this environment here. And yeah, when hey, I'm going to go over, across town because somebody else is going to kind of sit in here with you today because I got the new guy over here using us. And so it's a dance, to grow your business, but because you have to, as soon as you get complacent and say, all right, I've got, 3 really good customers. My competitor just launched something new has maybe better outcomes or is easier to use. And all of a sudden now I just, 30% of my business just got chopped. And now
Right.
I have been working with or trying to work with new surgeons. And I'll tell you what, in this world, it can be a long process.
Sure.
To get a surgeon interested in using your product, but then getting it approved.
Oh, yeah.
That's the major challenge, is the approval in the hospitals and the contracting.
So, meaning the surgeon might like something, but he still has to run it by the chief medical officer or whomever to say, this is why we should use it. But ultimately, they get to say, yeah, no, we're not going to go that route.
Absolutely. So this whole world of purchasing, GPOs, they call them, group purchasing organizations, and they kind of set the parameters, and all the companies are trying to race to contract themselves and pay to be on this GPO, right? For the GPO to say, hey, this is what your price should be.
Yeah.
And oh, by the way, next year it's going to be 5% or 10% less. But if you want to be in here and you want to play, because these 20 healthcare systems are a part of this, and that's how they do their contracting. You got to be on it, because when I first started in orthopedics and joint replacement, you had a lot of private practice, not a lot of hospital-owned surgeons. There's been a big paradigm shift over the last 15 years of, hey, we're getting out of the private practice because of the medical malpractice insurance. Our overhead is so crazy.
Yeah.
We've kind of our hands been forced, right? So now the surgeon who maybe was contracted to work with a couple different healthcare systems, who could say, hey, I want this product and get it in here. And it was done. And if you don't, I'm going to take all my patients and I'm going to go right down the road to your competitor.
Yeah.
And I'm going to do my surgeries there because they said, yes, they will prove it. Now the surgeon kind of lost their leverage.
Right.
And they said, no, you are an employee. This is what we're contracted with. And no, we're not going to. So that's a big thing. But I think there's some surgeons right now, and I may not see it in my time in this industry, are now saying, whoa, hang on a second.
Yeah, right.
We now are working for somebody versus them working for us. You're seeing some are going back to the private model and trying to find how to be sustainable, but they're coming up with a multi-discipline type of approach. Hey, I'm going to when I open this up, I'm just not a spine. I'm going to have physical therapy in here.
Yeah.
I'm going to have imaging in here. So it's true entrepreneurial for them, and that's a way I think will help us in the industry. I think down the road, but right now this is what we're just kind of told. This is what you got to do, and if you don't like it, sorry.
Yeah, right. I've seen a lot of doctors doing that integration where they literally start to say, okay, well, I work in, I don't know, hands, feet. And then you step 3 feet outside their office and they have a physical therapy area. Mm-hmm. And you have to sign off on the little paperwork that says, they're affiliated, that kind of thing. Mm-hmm. And they also know exactly what your insurance will pay for. So that's good for them.
Right.
But I'm very curious because you'd mentioned, hey, getting this product at this price, certainly large hospital groups have an opportunity there to negotiate. Mm-hmm. I never even thought of that. I really thought that if there's something that needs to be done for somebody's spine, knee, hip, whatever, that was just a cost pass-through to the hospital/insurance company. But like, how much is price involved? And what are some of the highest price versus lowest price types of devices that you have?
So yeah, I mean, it is price. It's driven. We're profitability for the the health systems because I have X price, but that's not what gets charged to the patient.
Sure,
it's so so there is a little bit of a markup there,
meaning that what your price is when it goes to the patient it's a little bit higher,
of course,
because they know the insurance
mark it up,
probably
mark up for the insurance and to cover that, right? And so there is a little bit of a profit margin there for them. So that's why we get whittled down, and no woe is me here. I mean, in our industry, we can give the discounts, but I mean, the company still there's margins there, right?
Sure.
If there wasn't margins there, we wouldn't be in this business, right? So, but it is, and I think more so now with big group purchasing organizations, they're trying to whittle down the number of companies that are allowed to come into their hospitals and into the health systems to say, hey, listen, I know there's 300 different spine companies you can choose from, doc, but we picked 3. And most of the big players in this have what they need. It may not be their choice, and but it's like, hey, because they gave us the best price. Right. And so we can there's certain things where it's wild. You look on, we can never give anything for free. I mean, that's it's illegal. But you could see some things that, like, hey, we're going to sell you this widget for 1 penny. Right. And so
1 penny we found out is the low end of the widgets you've seen.
There are some things out there that companies offer for 1 cent. And so someone looks at me like, wow, a penny.
Right.
Well, and so it's like you look at it and you're like, for us in the industry, you kind of cringe a little bit. You're like, listen, like I get it. We're trying to expand our business
Yeah,
and
that's a
everything,
marketing cost, right?
but we're devaluing what we do a little
Yeah.
bit right now. And so it's a slippery slope. We want the business and we want the volume, right? Because this is a volume based type industry. And so you're trying to scratch and claw, but it's a slippery slope because, hey, a health system down the road, 2 hours says, hey, I heard that you're offering this
Right.
to
Yeah.
them for this price.
Yeah.
You try to their volume's
Volume,
double
right.
what you do, and then now they're
Yeah, that's
offended, and
always
so
tough in
so
sales.
yeah, there is no. There's so much. They try to say, hey, we're going to keep this in house and keep it quiet as to what you're offering. It gets out. It does.
Sure.
So So we'll see how low we go with pricing. It's still coming down, and but I think some large companies are saying, all right, we're getting off
Yeah.
the group purchasing organizations. We're going to go and we're going to say we got the best people in the field. We've got the best product, and we're going to lose some business in these, but I'm not giving this away. I'm not
Right.
devaluing what
Yeah.
we have to offer. Because there's some
They'll
good,
keep coming
good,
back.
yeah, keep cutting back, and it's like,
Yeah.
hey, you can't get a blood from a rock, but their companies will, because there's so many options. Someone
Yeah.
who wants the business will say, I can do it. Yep, I
Right.
can do it.
Yeah.
You mean I'm on here and I have a chance? Yep, I'll do it. So
right.
yeah,
Chris learned
someone's
this-
always going to balk.
Chris learned this in his scalping business, where he's like, I'm not selling those tickets for $10 to go to the concert. I'll eat them first, right?
Right.
It's not worth it. They're
not
just going to ask for
devaluing, damn
lower
it.
and lower. They'll be waiting for it.
Right. I mean, Taylor Swift is Taylor Swift.
That's
I'm
right,
not just going to
yeah.
give these tickets away.
I mean, Dell doesn't work for free. Why should you?
Right.
All right. So, yeah, in the global medical device market size in 2023 is projected to be about $603 billion.
Mm-hmm.
So there's a lot out there. Oh, I don't know if I got the highest price widget that you've seen come through the market. You don't have to say what it is. I mean,
Well, in I guess you have robotics, right?
Yeah,
It
yeah, yeah.
is kind of the highest point, but they're shown to be very, very effective. And it's like in general surgery with robotics, gets very, very lofty.
Sure.
But for us, it's nowhere near that.
So you
selling
don't deal
a
with robotics.
titanium screw.
Right.
The robotics is entering into the spine world.
Yeah.
Yes, it's been there. We're getting into it now. First generation. It'll be interesting to see 10 years from now what it looks like, because it doesn't look the same as, say,
Right.
general surgery and what the robotics that they have out there right now, which is pretty unique. But yeah, it's entering.
But like
it's in
your
the spine.
company is in that, so you have to do a training on. I mean, you yourself, right? On here's how this robotic thing
Yeah.
works, and
Yeah,
so that's
exactly.
probably exciting, right? Like
It is.
now you're an engineer all of a sudden.
Yeah, right. It's kind of funny how the different things that you got to have and learn, and I mean, you got to fill your head up. There's only so much room in there, but the robotics piece, I'm very, very intrigued as to what this looks like here down the road and outcomes. So right now, the first generation it doesn't really tickle me right now yet. But some of the things that they're working on right now is pretty cool.
now I have to ask this too, because the name of this podcast is not in the job description.
Mm-hmm.
Anybody who's in sales has to deal with dejection.
Mm-hmm.
How often do you just have your ass handed to you when you're trying to make an introduction to somebody?
Oh man, every day.
Really?
I mean, I think in our world we got about a 3% hit rate.
Oh shit!
I mean, it is a lot of no.
Not
And
interested. Yeah.
No, thank you. Or, hey, yeah, I will, but go talk to this person over here. And then there's this layer that you got to
Yeah.
go through, and so that's why, yeah, you like I said, it's a low success rate
Yeah.
with it, but the 2 or 3% can be could be worth it as long as you're willing to kind of get through it. So, but yeah, I mean, there's a lot of times, through my career that I've, you sit there in a dark room and you're like, what am I doing?
So, Dan, you mentioned something earlier about COVID, and I wanted to circle back on that because I only imagine during that time frame when people weren't doing any kind of surgeries. I mean, hospitals were essentially closed unless you had COVID, and certainly any kind of surgery that was elective was off the table. I'm sure some of those surgeons were able to squeak by in those couple of years. They maybe put a couple bucks together, but that had to really impact the medical device industry, didn't it?
Oh yeah, yeah. I mean, we're still. Some lean years, there during that. But I mean, the first wave here in Ohio, I mean, we'll just say here what affected us. The first shutdown, it was 6 weeks. We still did, there were still traumas that had to be, but yeah, the volume was definitely not there. And I think some of us were like, okay, all right, if you're in this business long enough, you kind of, you put a little bit, because we're commission only, right? You got to put a little bit away,
sure.
To weather, loss of business.
Good advice for anyone, by the way.
Yeah, learn, don't spend your money all at once, right? Be smart. But yeah, and then the second wave, right, where we were shut, that was because it was longer, and they said, hey, listen, we're not making any exceptions for stuff, right? We were really, really shut down for about 2 months. And so we've dug out of that. Surgeons, have been really, I think when they came back, because no one was traveling.
Right.
So normally these surgeons, like, they might have 8 weeks of vacation a year.
Right.
And they would take time off, work hard, take some time off. Well, as soon as we got through that, and they had all these patients that, canceled in clinic and off the elective surgery schedule, all we did, we came out of the pandemic, and it was like, all we did was work.
Yeah.
Work. Because
To the OR, because they've got a line of people out the door.
A line of people trying to get through what was canceled, and so I think that stressed it stressed the industry. It stressed, what we have from an inventory standpoint. It stressed the healthcare systems out, because now people are like, wow, like, we are just grinding so hard to try to get through all this and this new world, post COVID. So it's anytime you get a pause from elective surgery, it's not going anywhere. It's going to be there, and it's going to be twice as much.
Right.
And now there's this panic of, God, do I have enough sitting around to help us get through?
Oh, yeah, your supply chains had to be destroyed too.
And we're still trying to figure it out and trying to get through it, because, you don't manufacture your own products.
Right.
Not a lot of companies do. Some do, but so they can kind of control that. And when you're relying on third-party entities to manufacture that, now you have that whole caveat, and how well do they manage their business?
Right.
And can they get people to come back to work? And so, yeah, it's a lot of, like I said, sleepless nights, wondering how I'm going to piece it together, because the surgeries are happening. They're not stopping them. They need them. And so figure it out, or it's the next man up.
You're back to those wooden knees, pulling them out of the stock room. Yeah.
It's kind of one of those things, you kind of panic and you look around and you're like, oh my God, how are we going to do this? And it's, but hey, your competitor beside you is like, man, we're going through the same shit right now.
Right.
And you look, so it's tough. So it's stressed us. And so hopefully we learn something from it. 3 years, post pandemic, I'm not 100% sure. We've learned. So we'll see. I reserve hope for it, but yeah, we're trying to figure it out.
Yeah, it's going to take a few years to get a lot of the manufacturing and everything ironed out. You just don't turn that off for a long period of time and expect to flip a light switch. That's for sure.
Did not happen. And like I said, I know the elective surgeries, the switch was flipped, and it's coming. But the industry is trying to recover from that.
Well, this is about the time in the podcast where I ask my co-host Chris, what did we learn today?
Yeah, I learned that the new guy gets stuck in the basement feeding the leeches.
That's true. It is true. I've heard that. That's on a T-shirt somewhere, I think.
Right.
I learned that, next time I talk to my doctor, I'm going to have to ask some questions because it sounds like if they're associated with a larger hospital, they may have narrowed their focus to a very few products. So I'm going to keep Dan in my back pocket whenever my back starts going out because I feel it coming.
Yeah. Call me.
All right. Well, thank you very much, Dan, for talking with us today. I'm Scott McLaughlin.
I'm Chris Kiernan.
Saying we'll see you at work.
Thank you for listening to the Not in the Job Description podcast. If you have a story you'd like to share, or if you'd like to be a guest on our podcast, please let us know by sending us an email with a brief description of your story to stories@notinthejob.com.